Well, Shadow Health Minister in New South Wales, Kellie Sloane, writes today that fewer symbols capture the quiet heartbreak of modern Australia more than the shrinking family table. She writes, fewer children, fewer siblings, fewer grandkids. And she says that Australia has gone from a baby boom to a baby bust in just a few generations, and that this demographic shift is reshaping our country's future. And for more on this, Kellie Sloane joins me now. Kellie, thank you very much for being here. Look, what are the figures, to start with, what do the figures tell us about how women or families are having fewer children?
Well, we know that, of course, in the baby boom, there was this huge population boom in Australia. But today, their grandchildren are having fewer children. So women today are having, on average, 1.5 children each. And to replace our population, we need 2.1. So that's sort of one for you, one for your husband, and a bit extra to cover those that won't have babies or who pass away. There are huge societal and economic issues with that decline. It means fewer taxpayers, fewer people to look after us when we're older, and a greater reliance ultimately on immigration. So I'm saying this is an unfortunate but very present issue of our time. 1 in every 17 kids in a school classroom is born through IVF today. So you get 1 or 2 in every classroom. It's a modern reality, and it's a reality that comes with couples having kids later, necessarily so, unfortunately, because of the cost of living and the other pressures on young families.
Yeah, so just to break it down, the reason that people are having fewer babies, is that economic reasons? Is it the cost of living? Or is it that we're marrying older and having children older, and of course then you often come across fertility issues?
So that is all of that combined. We're having kids later because we're having careers first, and that's often by necessity. So young couples today have it so much tougher than the generations before them. So if you are having a family or getting married back in the baby boomers generation, to buy a house, it would cost you 3 to 4 times your average annual salary. These days, it costs young people. It'd be so nice.
Yeah.
But these days, it's 10 to 15 times as much. And there are all sorts of other pressures, the cost of living pressures, population pressures. And unfortunately, people can't afford to have children early. Now, the unfortunate consequence of that is your biology doesn't wait until your economics catch up. So lots of couples are having fertility issues. It's a problem just as much for men as women. The IVF specialists say that in about 1/3 of cases, the issue is with the woman's biology, 1/3 is with the male, and the other 1/3 they just can't determine.
I didn't realise that. That's so
true.
Interesting.
Yeah.
So this has become a big political issue because the New South Wales government has scaled back the $2,000 rebate that the former coalition government had in place for IVF. Is that right?
That's right. So Dom Perrottet and the former coalition government brought in a $2,000 IVF rebate just to kickstart that fertility journey for couples. It doesn't come anywhere near paying the full cost, which can be between $8,000 and $12,000 for the first round, and many couples have many rounds. But it said, we've got your back. We're investing in you. We're going to get you started because it's important. It's important for families who have that ultimate goal of having a baby to cherish, which is so heartfelt, and it's our reason for being in many people's lives. But also there's an economic imperative. We need those future workers. We need those taxpayers. And a reliance on immigration to make up for that isn't the answer.
No, it puts more pressure on the housing crisis and the cost of living.
I guess so. The end point to that is that the Chris Minns government removed that subsidy in effect by means testing it virtually out of existence. So what they were saying is if you earn $116,000 as a couple, so that's $58,000 each, you are ineligible. So that discounts every key worker in the state. Your first-year teachers, your first-year nurses can't be part of this program. And I can't tell you, Sharri, the response that I've had from the community, from parents desperate to start families. As a result, IVF clinics across Sydney have had a rush of applications over Christmas time for couples trying to get in and take advantage of it.
Before it cuts off. Just very quickly, Kellie, before you go, your electorate is a state electorate, of course, but it's in the same federal area as Wentworth. What's the sense you're getting about how tough the battle is at the moment for the Liberal candidate, Ro Knox, against the Teal Allegra Spender?
I think it's going to be a tough battle for both major candidates. For Allegra Spender, who's the current member, facing a challenge by Ro Knox, who's an incredibly impressive Liberal candidate in the area, local businesswoman, someone who knows the area well, who's connected very strongly with the community. The landscape has shifted entirely from the last election when Dave Sharma was running, an outstanding candidate himself, local member, but we had that real shift, that change.
Yeah.
But the current economic circumstances, the border security issues, and the issues within the very large Jewish population in our community have meant that the pendulum has shifted enormously. This is a seat to watch, and if Wentworth falls to Ro Knox, the Liberal candidate, it'll be a Liberal government. So it's an important contest, and it'll be the one to watch, in my opinion, and Ro Knox is a candidate to watch.
All right, thank you so much, Kel. Really appreciate your time.